Hey everybody, I hope you're having a great day. Hey, I wanted to give you guys some tips with the 2017 Hruska Clinic shoe list. I'm just so excited that you guys get excited to get the list out every year, and with how we integrate feet with posture restoration activity. The characteristics that we look at in a shoe originated here at the Hruska Clinic about 9 years ago with the patient that I was working with. And some of those characteristics that we look for when we put a foot into a shoe is that we want that shoe to bend at the toe box. We want the heel counter to be stable. And we want to make sure that that heel counter also, if you press in here, that there's very little give, particularly on the outside of that foot. Some of the shoes are designed where they have a cut here, where they'll have a little bit more lateral heel give, or it'll be stiff here, but they'll be built up more on the inside of the heel versus the outside. What happens in either one of those scenarios is that your foot will stay on the outside of your foot, and the foot isn't able to roll in or repronate correctly during walking or during mid-stance phase of gait. So that's important in order to integrate a frontal plane with our patients. So those are the primary criteria that we look at. The most important criteria is also that the shoe is comfortable for your patient. And what happens is when I look at shoes with my patients, a lot of the times with the patients that we work with at the clinic, especially if they're a neck patient, they've got to be able to sense the floor a little bit differently. Can they feel their big toe? Can they feel their heel? Can they feel the inside of their foot, their outside of the foot, and comparing that from the left side compared to that of the right side? And that's what makes the New Balance 1080 shoe that I was so excited about last year, such a great shoe. This is a version 6 and this is a version 7 this year. And what is really unique about this New Balance shoe, you guys, is that the foam on the bottom, as well as the medial and lateral guidance that this shoe provides, allows for a foot to wobble. And when that foot can wobble, we get more triplanar integration with the foot. Remember, what we need out of our right foot is different than what we need out of our left foot with PRI activity. Our left foot, our patients need to be able to integrate a left heel and a left big toe. And on our right foot, they need to be able to integrate pronation during the mid-stance phase of gait. So they need to be able to roll their foot in and sense the right arch. This shoe not only allows for that, but it also allows for both the left and the right side of the foot to do something different. And we personally have not seen that in any other shoe because of the guidance that this shoe provides both in the inside and the outside. The only change with the version 7 from the version 6 this year on the shoe list is that they took the midfoot guidance and they backed it out a little bit, because they were having complaints of their shoe testers were having complaints of having rubbing on the metatarsal heads on the first and the fifth toe. So they backed this off a little bit. And the toe boxing is a little bit more narrow to me, but not a lot. But that's the only thing that changed. It still bends at the toe, still has a good heel counter, and it still has that awesome foam bottom. This is the only shoe that provides both medial and lateral guidance. That's what makes it so awesome. So anyway, New Balance, this is a version 7. Version 6 comes in a lot of different colors. The other change, you're also going to see a couple of other New Balance shoe on the shoe list. You're going to see a New Balance 860 V7, so a version 7. And you're also going to see a New Balance 880 V6. And both of those have the foam bottom like the New Balance, but neither one of them have as much of the midfoot guidance. So that's the difference between those two shoes. The 860 provides a little bit more medial support, and the 880 is more just neutral. You're not getting lateral or medial support. I wanted to let you know that we took off the Saucony Omni shoe from the 2016 list. And also the Saucony Echelon. No, we left the Echelon on, sorry. The Omni we took off because if you bend it at the toe box, the heel came up too prematurely. And so we want that heel to stay on the ground a little bit longer when we start to engage the toe-off phase of gait, and it was prematurely coming up too quickly. As far as the other shoes, the Brooks Glycerin 14, you're going to see our most favorite shoes highlighted and underlined. The Brooks Glycerin 14 is probably my favorite shoe for people that need an orthotic. The New Balance 1080 is not my favorite shoe with an orthotic, with the PRI orthotic, but I do like the Glycerin 14, and I also like the Brooks Transcend 14, the Brooks Transcend number 4. So those two shoes tend to be my favorite when I'm looking at orthotics. You're going to also see that we shortened the list quite a bit. And the list was shortened just because there's a lot of shoes that have these criteria. But remember, we look at shoes differently as PRI trained physical therapists. So remember, what does your patient sense on the floor? What can you see subjectively differently that they can wobble that foot and ankle? Are their PRI tests negative at the head, neck, trunk, and pelvis when you look at shoes? Just because a shoe is on this shoe list doesn't mean it's a perfect shoe for your patient. So you're going to have to watch them walk. What do they sense to look at your PRI test to see what determines that works best for your patient. Also on the shoe list, we added, I think about 6 months ago, some zero drop shoes, the Ultra shoes. And I would really caution you, these have worked really well with some of our patients that have had calcaneal discomfort. But I would really encourage you, when you integrate the zero drop shoe with someone, that they can really sense their heel, and you want to transition into them slowly. All the other shoes on there, their heel's going to be slightly higher than a toe, and that's going to allow your patient to sense and feel their heel more. With the zero drop shoe, both the toe and the heel are level, and that may be challenging for some of your patients, so I would really caution you if you're using those with your patients. They are the Ultra Torin, the Ultra Paradigm, and the Ultra Pro Vision. The Ultra Paradigm is a really good rocker shoe if you need someone that has limited first ray extension. The Pro Vision has a little bit more medial support if you need it, and the Ultra Torin is more neutral. It doesn't have a lot of guidance either medially or laterally. But those shoes could work really well for some of your patients that are coming into the clinic, but they're not my first go-to shoe. But I wanted to let you know because some people have asked about zero drop shoes. You're going to see the pictures on here, just like you have in the past. And remember, we have stuff in a control category, a guidance category, and a cushion category. And when we work with people that are dental patients or vision patients with our integration, we really like shoes that are in the cushion category, as they tend to help our patients to be able to sense the floor to inhibit a neck. So just remember, we look at shoes differently. Don't be afraid, you guys, if you have someone that has a lot of instability, to put them in a shoe that provides a little bit more control. But 3 or 4 months down the road, you guys, you might need to go into the guidance category. They don't need that much support. They might need a little bit more stability, like to work in a shorter range of motion. But as they get more stable, they might need to be able to work in a wider range of motion in order to feel the entire floor with their foot. So sometimes I take people out of their PRI orthotics, or we take them from a control category to a guidance category. So I hope that helps a little bit. Just remember, we are putting feet in a shoe. We're not putting shoes on a feet. And we look at shoes differently with PRI. I hope the video helps. Have a great day.